you all. Good morning all. My name is Dr. PJ Madam Rafi. Today we are going to discuss about hypolipidemic drugs. Okay, means drugs which is decreasing cholesterol levels. So first we'll see what are the three major lipids in the blood. What are those? Will have cholesterol, triglycerides and phospholipids. Cholesterol is a major source for bile acid synthesis and steroid hormones. Then triglycerides will be used as a source of energy in muscles and adipocytes will use as a source of energy. Then phospholipids also will use for cell wall synthesis. So these major lipids will be transported in the body with the help of lipoprotein. Okay, this is an MCQ. So based on their density and presence of apolipoprotein and the lipoprotein, these will be divided into following types. Those are chylomicrons, VLDL, LDL, HDL. Okay, that is very low density lipoprotein and low density lipoprotein, high density lipoprotein. Okay, so if you see here, chylomicrons normally produced in the gut. That means based on our food consumption, chylomicrons will be formed. They contains more triglycerides and less cholesterol. But VLDL, these will be produced in liver. These will contain compared to more cholesterol. They will have more cholesterol compared to chylomicrons. That's why they will have both triglycerides and cholesterol. But cholesterol level will be more compared with chylomicrons. Next, we will see the lipid metabolism. So normally after food consumption, small intestines they will form chylomicrons. Once these chylomicrons will absorb into circulation, they will pass through the blood vessels. In the capillary blood vessels, we will have an enzyme that is lipoprotein lipase enzyme. These lipoprotein lipase enzyme will convert chylomicrons to free fatty acids. These free fatty acids will get absorbed by muscles and adipocytes. That's why these chylomicrons will use some of the cholesterol or triglycerides. Okay, then the remnants, then the passing out chylomicrons will called as a chylomicron remnants. Okay, when these chylomicron remnants will be having a binding protein, that is apoprotein E. So this chylomicron will be taken up by liver and it will helpful in the synthesis of cholesterol. This cholesterol will be useful for production of hormones, bile acid synthesis, all this source of energy, all these things will use this cholesterol. Okay, so normally from intestines to liver will have chylomicrons. Okay, and liver to peripheral bodies we have VLDL, LDL. From peripheral to liver we have HDL. Okay, that's why the HDL is a good cholesterol. The VLDL, LDL, all those things will have a will known as bad cholesterol. Okay, so next slide we'll discuss what are the types we'll have in hyperlipidemias. Okay, this is the MCQs. In this we'll have 1, 2A, 2B, 3, 4, 5. Here main important thing is 2A, because in 2A we'll have mainly elevation of cholesterol. Okay, they will ask question like which of the hyperlipidemic disease will have increase in only cholesterol, or it doesn't have triglycerides elevation, that is 2A, that is hypercholesterolemia. Okay, next thing is in normally this 2A, 2B, 3 and 4 they will have more chance of developing erythrogenesis. Okay, so this 1 and 4 they doesn't have that much of chance of developing erythrogenesis. Rest of 2, 3, 4 they will have more chance of developing erythrogenesis. These two are very important MCQ, so you should remember. One is which type will have more chance of developing erythrogenesis. Second thing is in among 5 families, which group will have only elevation of cholesterol means 2A, or which group doesn't have elevation of triglycerides also 2A. Okay, thank you. Next is, so in liver cell, so this is the pathophysiology. So normally when by taking diet will form chylomicrons. This chylomicron will be useful in formation of cholesterol synthesis. In this cholesterol synthesis there is one enzyme will be helpful, that is HMG coenzyme reductase. Okay, when this enzyme is get inhibited, obviously what will happen, there will be no formation of cholesterol. When the liver doesn't form cholesterol, what will happen, so there will be production of hormones, bile acid will be decreased. So liver will have compensatory mechanism. So in compensate mechanism what will happen, liver will form more LDL receptor on the surfaces. Okay, when it generates more LDL surface on the LDL receptors on the surface, what will happen? These LDL receptors will be helpful in consumption of peripheral cholesterol, that is in the form of LDL, VLDL in the circulation. So when this cholesterol synthesis is inhibited, obviously in peripheral we have elevation of LDL and this one VLDL. So those will get consumed into liver and help in formation of cholesterol. By this thing, what will happen? One thing is peripheral cholesterol level will be decreased, that is VLDL, LDL level will get decreased. Second thing is obviously it will helpful in production of bile acids and hormones. Okay, this is how this cardiac drug, all these hypolipidemic drugs will be helpful in controlling of cholesterol. So next we will discuss final thing is hypolipidemic drugs. In hypolipidemic drugs we will have certain drugs will be there, that is HMG coenzyme A reductase enzyme inhibitors, then cholesterol absorption inhibitors, bile acid sequestrants, fibrates and vitamin, that is nicotinic acid derivatives. Okay, we will see each one. First one is HMG coenzyme A reductase. This is a major rate limiting enzyme in the synthesis of cholesterol. Okay, by inhibiting this enzyme, what will happen? Obviously cholesterol synthesis will be decreased. Okay, so for a body hormone synthesis and bile acid synthesis, we need cholesterol. So obviously there will be rise of LDL receptor in the liver. So obviously there will be more peripheral consumption from the blood. So there will be decreasing VLDL and LDL level in the peripheral blood. Okay, so in this group what will the drugs will have? Atorvastatin, pravastatin, simvastatin. Okay, so these are statin drugs. These are mostly preferred in the night times. Okay, and these statin drugs will have one more effect, that is pleiotropic effect. Pleiotropic effect means these drugs will have antioxidant property, anti-inflammatory property and anti-proliferative property. Okay, these three properties will be there. This is known as pleiotropic effect. Next is cholesterol absorption inhibitors. By the name itself, these drugs will inhibiting cholesterol absorption. So obviously cholesterol is needed as energy and some hormone synthesis, all those things. So what will happen? So once these drugs will inhibit one protein, that is Niemann Pick C1 like, okay, NPC1 like L1, when these drugs inhibiting these these sites, obviously cholesterol absorption inhibitors, when these drugs are inhibiting cholesterol absorption, there will be need of cholesterol synthesis in the liver will be elevated. So to compensate that one, there will be more peripheral consumption of LDL, VLDL from the peripheral bodies. Okay, so there how these drugs are helpful in decreasing cholesterol in the peripheral blood. Next is bile acid sequestrant. Bile acid will be how means, normally these are the drugs, that is cholecysalam, cholestyramine, cholestyramine. These drugs will inhibit bile acid reabsorption. When these drugs are inhibiting bile acid reabsorption, obviously there will be rise of bile acid production in the liver will be elevated. So to synthesis more bile acid, obviously more cholesterol will be needed. So obviously there will be more LDL and VLDL absorption from the peripheral blood will be elevated. So therefore obviously LDL and VLDL in the peripheral blood will be decreased. Okay, next drug will be fibrates. In fibrates we will have bisafibrate, fenofibrate, gumfibrozil. Okay, these drugs mainly acting through PPAR alpha factor. Okay, and these drugs will elevated lipoprotein lipase enzyme. So thereby they will decrease. There will be increased lipolysis. Obviously, thereby decreasing triglycerides level in the blood. Okay, by increasing lipoprotein lipase enzyme activity, obviously increase lipolysis. So obviously they decrease peripheral this cholesterol level in the blood. Next one is nicotinic acid derivative. Nicotinic acid is a vitamin B complex, the vitamin B complex one group, this one. So obviously this will act on hormone lipase enzyme, thereby they reduce lipolysis and also reduce triglyceride levels. Okay, so this is a like MCQ. Which of the vitamin B group drug will be helpful as a hypolipidemic drugs? Obviously this one niacin. Okay, that is vitamin B3. Next recent drug is PCK9. This is PCS K19 inhibitor. What is PCS means? It is a pro-protein convertase substituting hexene type 9. So these are recently developed molecule. They will act on LDL receptor. what is means this, when these drugs will in inhibiting LDL receptor, obviously they will control the cholesterol level. So what are the drugs in this group? Will have hypolipidemic drugs. What are those? Alirocumab and evolocumab. These are newly evaluated drugs for controlling lipids, okay, blood lipids in the hyperlipidemia patients. Those are alirocumab, evolocumab. Okay, these drugs will inhibit which of the this one, PCSK19 inhibitor. Okay, this is an inhibitor which will act on LDL receptors, thereby decreasing cholesterol level in the blood. Okay, those are alirocumab, evolocumab. Okay, these are the group of drugs will be helpful in decreasing cholesterol in the blood. Thank you.